Hello everyone. Today our topic of discussion is osmolar gap, and osmolar gap has a lot of clinical importance, and today we will learn about it. Before we discuss about osmolar gap, let's first learn about what is osmotic pressure. So let's say this is a cell, and cell has different particle. So osmotic pressure is basically created by these particle to keep the water inside the cell. So the key concept is the osmotic pressure is created by the particle inside the cell and it will keep the water inside the cell. So it is driven by solute concentration. So higher the solute concentration, higher will be the osmotic pressure. And lower the solute concentration, lower will be the osmotic pressure. So if we draw another cell beside this cell, and let's draw some particle in this cell also, and we name it cell A and cell B, because osmotic pressure is driven by the number of particles inside the cell, and we know for osmosis to happen the water will move from low solute to high solute concentration. So cell A has less particle, it has less osmotic pressure, so the water will move from low solute to high solute concentration. Because cell B has 5 particle and cell A has 4 particle, so water will move from low solute to high solute concentration, and that will result in swelling of the cell. The osmotic pressure will depend on number of particle, but it will not depend on size of the particle or type of particle. It's an important concept to remember. Now, why osmotic pressure matters in our body? Why osmotic pressure is important in our body? So let's take the example of cell A and cell B. Inside the cell, we have intracellular fluid, and outside the cell, we have extracellular fluid. So we have some particle in the cell, and we have some particle outside the cell. So now, if the osmotic pressure is high in the extracellular fluid, the water will move from low solute to high solute concentration, because intracellular fluid has 3 particles, extracellular fluid has 4 particles. Water will move from low solute to high solute, and that will result in shrinkage of cell. And let's say if the extracellular fluid have less particle, let's say only 2 particle here, the water will move from low solute to high solute, which is intracellular fluid, and that will result in swelling of the cell. So why osmotic pressure is important in the body? Because it is responsible for cell volume regulation. Our blood also has a osmotic pressure. It has a osmolality, and to maintain the normal cell of the cell, normal size of the cell, blood will maintain the plasma osmolality of 275 to 295 milliosmol per kg. That's the normal osmolality of the blood plasma to keep the cell stable. Now, what is the clinical importance of this? So, it will play a role in dehydration, high sodium, low sodium, when you give IV fluid, in cerebral edema. So that's how it is clinically relevant. Next is, what is osmolality? What is osmolality? Osmolality is a concentration of dissolved particle. Is a concentration of dissolved particle per kg of solvent, per kg solvent of water. So basically the osmol, it represents the number of particle. So what kind of particle can exert osmotic forces, or which can be considered as osmol? So the example is sodium, potassium, chloride. There can be a small molecule like glucose, urea, ethanol, or sometimes toxic alcohol like methanol, ethylene glycol. Keep in mind that osmolality depend on number of particle, not their size or weight. Now, why it is important in the body? Why osmolality is important in the body? Because osmolality determine the movement of water across cell membrane, and it will change the cell volume. So the cell can increase in size or shrink in size. So that's why it is important. Our body tightly regulate the plasma osmolality between 275 to 295 milliosmol per kg. Now we know about osmotic pressure. We learn about osmolality. Now let's come to our main topic, which is osmolar gap. What is osmolar gap? Osmolar gap is the difference between measured serum osmolality. So when the patient comes to the hospital or in the ER, you get the blood draw, and from the blood draw, you can get the serum osmolality from the blood draw. And then you can also calculate the serum osmolality by a formula, which is, so calculated serum osmolality is equal to 2 times sodium plus glucose over 18 plus BUN over 2.8. By this formula, you can calculate serum osmolality. So if you have a measured osmolality from blood and you minus it from serum, calculated serum osmolality, you will get the osmolar gap. Normally the osmolar gap normally should be less than 10. But if it is greater than 10 or at least greater than 15, that means that the osmolar gap is high, especially if it is greater than 15. So this is the formula for osmolar. This is the formula that how you calculate serum osmolality. We discussed about it. So osmolar gap is equal to measured osmolality minus calculated osmolality. Now, what are the causes of elevated osmolar gap in the body? So it can be from toxic alcohol like methanol, ethylene glycol, propylene glycol, isopropanol, diethylene glycol, and then other causes are diabetic ketoacidosis, renal failure, lactic acidosis, mannitol therapy, shock, severe illness, hyperlipidemia or hyperproteinemia can be a lab artifact. What is the clinical use? So let's take the example. So let's say you are working in the ER and you are suspecting a patient who come in with alcohol intoxication or methanol intoxication. So let's say patient is confused, but patient is acidotic. Acidotic. If you're suspecting methanol ingestion, you can actually calculate the osmolar gap. So you will get the measured osmolality from the blood, and then you calculate the osmolality, which is called calculated serum osmolality, and that will give you a osmolar gap. If it is high, let's say greater than 15, you combine it with clinical situation. So let's say in any patient with methanol ingestion, which can be present in antifreeze, methanol can be converted into formic acid, which can affect the optic nerve, which can lead to blindness. So these patients sometimes require fomepizole therapy to reverse it. So that's the clinical importance of elevated osmolar gap to reach to the diagnosis. So the other example is mannitol therapy, which we sometimes use in brain bleed patient, especially if they have high intracranial pressure. So in this example, so let's say you have brain cells which have swelling, and you are giving them mannitol. So this is a blood vessel. You are giving them mannitol therapy that will increase extracellular fluid osmolality. So water will move from low solute to high solute concentration from the brain cell towards the interstitial fluid, towards the plasma, and that will decrease the swelling of the brain cell. So that's how it is helpful in brain bleed who have high intracranial pressure and brain swelling. So these are the couple of clinical example. Now how you calculate the osmolar gap? Let's look at this example. So let's say you have a patient who come to the ER and you did the basic blood work, CBC and BMP. Your sodium is 140, glucose is 90, BUN is 14. You check the blood work, you draw the blood and you measure the osmolality, which is 305 here, and then you calculate the osmolality yourself with the formula. It's 2 times sodium plus glucose over 18 plus BUN over 2.8. You put in the well values. 2 times 140 plus glucose is 90 over 18 plus BUN is 14 over 2.8. It will give you a value of 290. So your osmolar gap will be your measured osmolality, which is 305, minus calculated osmolality, which is 290, and your gap will be 15. So this is high, and it means that there is a presence of unmeasured osmoles in the body. So this is how you calculate the osmolar gap. So we discuss about what is the osmotic pressure, we discuss about osmolality, we discuss about the formula, how to calculate the osmolar gap, we discuss about the causes of elevated osmolar gap and its clinical importance. Thank you very much. Have a nice day.